This is how our patient first came to us. And in the tomographic images, the implants are not completely inside the bone. They're positioned more forward. Hello there, I'm Dr. Onur Utku Yüksel from Soho Dental Clinic. I'm a specialist in implantology and periodontology. Many patients come to us after having had implants done elsewhere, unhappy with the results. Sometimes they come with aesthetic problems that can't be fixed due to incorrectly placed implants, and other times with complaints of pain and infection requiring revision implant surgeries. These revision cases are much more challenging than operations done from scratch. For us, the greatest happiness in these cases is restoring the smiles and self-confidence of these patients who are in a dramatic situation. Now, I want to tell you the stories of the revision surgeries for some similar cases. This is our first case regarding the revision of a failed implant treatment, which I'd like to share with you. This is how our patient first came to us. At another clinic, 6 implants were placed in her upper jaw. The implants are very short, about 6 millimeters long, and in the tomographic images, the implants are not completely inside the bone. They're positioned more forward. The patient is in pain. Also, after the implant surgery, the patient was left toothless like this for 3 months. When we performed this treatment, we took tomographic sections and measured the bone volume. Then, as a plan, we decided to replace all of the implants. Immediately after the operation, as you can see here, we placed long implants that get support from the nasal floor and have high primary stability. Then, we delivered this metal bar you see and her temporary teeth on top of this metal bar to our patient 1 day later. Here, when we compare the before and after, the angles of the implants, their lengths, and the fit of the implant and prosthesis parts are very good. Perfect. With no problems at all. With these small pins you see here, we augmented the bone defects in the area using a graft membrane and pins. Then we delivered the temporary teeth to our patient, and this is the final image. This patient will now wait for 3 months to heal with her temporary teeth in her mouth, with her stable implants, and without losing her self-confidence. And as you can see, this is how the patient leaves the clinic after the appointment is finished in a calm and orderly manner. In implant treatments, you're not just buying an implant. You're actually paying for the surgery of the implant. No matter the implant material or brand, if there is an experienced surgical and an experienced prosthetic phase, the success of the implant is over 99%. But implants placed by inexperienced hands and prosthetic parts made without the proper experience unfortunately lead to additional financial loss, additional loss of time, and most importantly, a loss of self-confidence, just like with this patient. We will continue our series on revision treatments. I will frequently tell you about our patients for whom we perform revisions like this. Thank you. When patients choose a clinic, their goal shouldn't just be to buy a good brand of implant for the cheapest price. It should be to find an experienced team they can trust to perform such a delicate surgery. Don't leave things to chance and gamble with your health at inexperienced establishments that are only focused on cheap prices. If you think you need implant treatment, or if you have a complaint about your existing implants, please don't hesitate to have an online consultation with us.